So we're going to talk about that. So I got interested in this area because I used to be an emergency physician, and I used to work in intensive care, and when I was on call, we used to get lots of patients with head injuries. Young men in high-speed car crashes usually. This man, I think he's in Thailand, he's just been hit by a Toyota, he's got a serious head injury, his brain is expanding in his skull. And I'd come across an organization called the Cochrane Collaboration. Has anybody come across the Cochrane Collaboration? Yeah? Anybody? So some of you have heard it. Anybody who hasn't heard about it? Yeah? Okay, the Cochrane Collaboration is an organization that tries to make systematic reviews of the evidence for the effectiveness of different healthcare interventions. It tries to make it easier for doctors. So when a doctor has a patient and they think, well, this particular treatment, is it effective, is it not? Well, you know, rather than getting that doctor to go look for all of the trials, there's an overview of all the trials available, you know, on this in this Cochrane Collaboration, on this Cochrane library, and these systematic reviews. And the Cochrane Collaborations, you know, tries to provide evidence that doctors can trust so that they can make informed decisions for better health. So I got involved in the Cochrane Collaboration, and I started a group that does systematic reviews of evidence for the effectiveness of treatments for injury. Yeah. And one of the treatments I was interested in, because you get a lot of patients, like in this paper I've shown you, that they have a head injury and their brain starts to swell, and if the brain swells too much, it sort of like pushes the brain down into the spinal cord and the patient dies. And that happens quite quickly. And you can give them into the veins this a solution called mannitol, yeah? And it's like sugary water, basically. It's like very sugary, and it pulls water out of the brain by osmosis, yeah? And shrinks the brain a bit. It gives you a bit more time, yeah? So the patient can die very quickly, but if you give them this sugary water, it shrinks the brain down a bit, hopefully give you a bit more time. And I was interested in the evidence from randomized controlled trials about this treatment. And I searched for all of the evidence on this treatment. I don't know, I think I found 3 or 4 randomized controlled trials. And I reviewed it, I did a meta-analysis, and we concluded, and I was the first author of this paper, in patients with acute intracranial hemorrhage, the administration of high-dose mannitol reduces mortality. You know, it's quite dramatic, big reduction, yeah? Relative risk of 1, that means the treatment's not effective. So the relative risk is the risk of death in those who got the treatment divided by the risk of death in those who didn't get the treatment. So if it's 1, there's no effect. If it's less than 1, the treatment's good, yeah? Well, look, 0.55, that's good. That's almost a halving of mortality, yeah? 0.55, and, you know, the p-value is very small. You know, it's a highly statistically significant result. So this seems to be a very good treatment, yeah? I thought so, and I published it in this Cochrane library. And then I was at a, then I met somebody. We were doing a big clinical trial involving lots of doctors from all around the world. I met a doctor from Colombia, and he said to me, Ian, you do know all of those papers that you included in your meta-analyses were fabricated. And I said, what? I didn't know that at all. So the paper that you've all looked at is one of them. So there were 3 papers by the same author, Cruz. Actually, there's a typo here. That should be J. There were Julio Cruz. Julio Cruz, a Brazilian author, wrote 3 studies on the effect of high-dose mannitol in patients with acute severe head injury. And this Colombian said to me, all of these trials are fabricated. And I said, well, how do you know that? How can you be sure? And he said, well, this particular doctor didn't have any head injury patients to do trials on. They just didn't believe they were. So I thought, well, now I have to investigate. I have to find out if these, something more about these trials. So they were all by the same author. They had other authors. Minoja is an Italian, I think, and Okuchi, a Japanese co-author, and Facco is an Italian. So these authors seem to work together and to make these papers. And I thought, well, let's find out more about these. Now, I looked for the address for correspondence. Actually, it might be on this paper. The Comprehensive International Center for Neuroemergencies at the Federal University of Sao Paulo. So there is no Comprehensive International Center for Neurosurgical Emergencies. It's just a P.O. box in Brazil. It doesn't exist as an entity. I wrote to the Federal University of Sao Paulo about their professor, and they said they never employed him. He's not a professor at this university, they wrote back to me. I wrote to the Brazilian National Ethics Committee. There was no evidence of any ethics approval of any of these studies. And then I wrote to all the co-authors. And the co-authors said, well, we didn't put any patients, no patients from our hospitals were in the trial. We were invited to be a co-author on these papers by Dr. Cruz, Julio Cruz. And in fact, I think on the next slide, yes, these are extracts from the emails they sent to me. So it was a pleasure to be included among the authors of papers written by Dr. Cruz on the use of high-dose mannitol. My unit and I did not provide a personal series of randomized patients, but my contribution was discussing him and sharing his assumption because occasionally blah, blah, blah. So, he just contributed to the discussion a little bit. This one is one of my favorites. I did not conduct any study related to the results of Dr. Cruz's high-dose mannitol trials in Japan. This is the Japanese author. I have no data to present to you. I did not know any part of the paper before he called me about acceptance in the journal. How interesting. So you get a call and someone says, Callistus, it's good news. You're published. Yeah. And you say, great. You don't say, what do you mean? You say, wow, that's great. What did I do? So didn't know anything about the paper until it was published, And then, after it was published, didn't complain. Extraordinary, isn't it? And then, so all of the authors were the same. All the authors were, it was almost a gift to them. They didn't contribute very much at all. They were just invited to be co-authors on the paper. Then it gets worse, because I wrote to the journal that published the papers. And I wrote to the editor. And I said to the editor, I tried to contact him by phone, but he didn't answer. And then I left a lot of messages on his answer phone. And then he wrote to me. And I was amazed that he put this in writing. This is what he said. I tried unsuccessfully to contact you by phone with regards to the Cruz papers. As you can tell by the editorial, we all doubted the data. But to doubt is different from concluding that he fabricated the data. I thought he did, but hoped, as stated in the editorial, that publication would encourage repetition of the studies. Wow, it gets great. Isn't this great? Now the editor of the journal that published the papers thought that the papers had been fabricated and published them. That's great, isn't it? It's very strange, isn't it? So we've got this guy, doesn't work for the university. His co-authors don't know anything about the results. The journal editor thought they were fabricated. Julio Cruz himself had committed suicide. So he was obviously a very sad, lost man, wasn't he? I contacted the co-authors. I said, look, this Julio Cruz, I can't find any. I've done an investigation. It took me a long time, best part of 3 months. I can't find any evidence that these studies ever took place. You haven't got any evidence that they ever took place. Will you retract the papers? Will you actually take them out of the medical literature because they're not true, And they wouldn't. They refuse to. They remain available on PubMed, and there's no evidence that they ever took place. So if you go onto PubMed now, you'll find these papers. They're just there in the medical literature. The editor doesn't want to retract them. The authors don't want to retract them, so they're just there. It's very interesting. And they will be used on patients, and this treatment will be used on patients around the world. So I thought it was bad. So that was my first experience of research misconduct. It's a little bit like yours over there, isn't it? You start reviewing the evidence and you take it all on trust, and then you get more suspicious, don't you? You think, my goodness, this doesn't make sense when you start looking at it in more detail. Then I had another experience. I was very interested in fluid resuscitation. This is a trauma patient he's got an infusion going there. And there's two different kinds of fluids. You can have crystalloid solutions, which are like salty water, or you get these colloid solutions like, Hemax cell and, gelatin. And people have always wondered which one of these treatments is the best, and they've done randomized controlled trials comparing them. So I was involved in a systematic review of these, and there weren't very many trials. They didn't have very many patients in, but these trials here, all done by the same author, suggested that the starch solutions, the starch colloids, were actually better. And starch colloids were quite commonly used. And then this is what happened. In December 2009, this guy, Bolt, who's the author of these papers, he published a study comparing these two different drugs. The editor receives emails questioning the integrity of the research. One of the reviewers said that his results must have been magic. In November, the hospital where Bolt works makes an investigation and finds no data from any of these studies. They can't find any evidence that they were ever conducted. The ethics committee, all of his papers do mention an ethics committee, but the ethics committee doesn't exist. He made up the ethics committee. The ethics committee of some place in Germany, it just doesn't exist. So 90 papers were retracted from the literature because they were all fabricated. So all of these 90 papers were taken back. Because the British guidelines on fluid resuscitation of injured patients included many of these 90 patients, they had to withdraw the guidelines because these guidelines referred to these clinical trials. So all of these, the guidelines were withdrawn, And then there was a meta-analysis conducted that excluded the papers that were fabricated, and it got quite a different result. And actually the result was that not colloids are beneficial, but colloids are harmful. So the publication of these fabricated trials was, probably damaged patients. It's a very serious thing. So when you look at, the relative risk for death, when you take out the Bolt trials, there was a non-significant increase in the risk of, well, a significant increase in the risk of death and a significant increase in the risk of renal failure. So we've been trying to get this treatment is still marketed, still widely used. It's less commonly used in Britain now because we all know about this Bolt case, but when pharmaceutical companies have an experience like this, they actually redirect their marketing strategies to places like Africa and China, where people might not have heard this story. And they can, and they're still marketed. There's no evidence that they're effective. So the Cochrane collaboration that I was very excited about, I became much more skeptical about it. I describe it like, it's a little bit like, when it's like falling in love. I'm sure people in this room have fallen in love. But when you fall in love, you just think everything about this person is just perfect. Don't you? There's everything. They like the same food as me and the same music. Oh my God, they're so right for me. Yeah? But then after about 6 months, oh my God, he's late again. He's such a pain in the neck. You kind of, all that beautiful rosy picture starts to get less rosy. That's what happened with me in the Cochrane collaboration. I thought when it started, wow, this is fantastic. This is it. You get all the evidence, you gather it all together, and you find out what works and what doesn't work, and that's great. And then I thought, but now when I fell out of love with it, I realized, well, it just takes everything on trust. That's not really reviewing the evidence. You take a piece of paper and you just think, well, everything on this paper is true. I'm going to take this, everything on this paper is true, and I'm going to make recommendations for patient care. It's quite trusting, isn't it? Do you know what I mean? It's an extraordinary level of trust that anybody can write a paper, they can send it to a medical journal. The medical journal will not check anything about the data. They only check what's written on the paper to see if what's on the paper makes sense to itself. Yeah? It doesn't have to relate to anything, right? They don't check if there was an ethics committee approval. They don't check if there was any patients actually recruited. They don't ask to see the data set. They just say, okay, you've given this paper, everything you've written on this paper is true, now we'll go and, they take it all on trust. I personally don't think that's acceptable anymore. It has no policy in fraud. And so really it ignored fraud. Lately, in the last month or two, after a lot of, some colleagues and I have been trying to persuade the Cochrane collaboration to make a policy on fraud. They're developing a policy on fraud. And then I had another experience. I do a lot of work on hemorrhage. postpartum hemorrhage in particular. And I had, some time ago, I'm not sure when this was, 2008, I made a systematic review of randomized controlled trials of treatment for drugs, of this drug, tranexamic acid, tranexamsan, I think you call it here, for the prevention of postpartum hemorrhage. And we concluded that, I think so, tranexamic acid reduces blood loss in postpartum hemorrhage. Then I got, nowadays, now having fallen out of love with systematic reviews, I'm much more skeptical. And we looked at these trials again. And then we did this with a colleague of mine called Catherine Kerr. And Catherine Kerr is looks very good at finding details, noticing important details. And she noticed that in the first study by Guy, a Chinese author, I think, in 2000, there was a sort of typo. You can get prospective randomized controlled clinical trials, but you can't get prospective randomized case-controlled clinical trial. There isn't such a thing as a case-controlled clinical trial. It's an error, yeah? There are randomized trials and case-controlled studies, but they're different. You can't get randomized case-controlled trials, yeah? So there was a typo in this paper. But the thing that Catherine noticed is that the typo was also found in all of these other papers. Right? Wow, it's interesting. They all made the same mistake. A bit suspicious. So what we did is we got all of these papers and we put them on the floor of the office. And we looked at them. And they all had the same text. They were from different authors in different countries at different times, but most of the words in the paper were exactly the same. Yeah? And like, so delivery by cesarean section can cause delivery by all the same. And then we looked at the results. I mean, sometimes I've had students from, say, I don't know, India or whatever, and they say to me, sometimes, oh, come on, they say, you know, as regards to plagiarism, they say, oh, come on, Ian, you know, it's really difficult. If English isn't your first language, well, India is not a good example, but say you come from a country where English isn't your first language, and they'll say, look, you know, it's all right for you, who English is your first language, you know, to make up very nice sentences that sound beautiful. But for us, it's much more difficult. So if we find a nice, beautiful sentence, we use it, you know. I mean, there's some, you know, you can have a little bit of sympathy for that. Maybe if you acknowledged that it was taken from there, you know. But, I mean, this was almost going a little bit further. It was a very nice paper, so we took it all. But more suspicious is the fact that they seem to have taken the results as well, because these are the ones that we didn't suspect plagiarism. This is Toyo, and this is the Toyo papers, the plagiarism suspected, and they seem very similar results, yeah? Almost 0.79, 0.79, 0.79, you know, almost identical results. Something going wrong. So we don't trust those. In fact, yeah, we don't trust them at all. Now the Cochrane collaboration uses all of these systems for weighting the level of evidence, and they use a system called GRADE that some of you might have come across, but it's all based on what's written in the manuscript being true. And often it's not true. They trust everyone. And I've sort of changed my feeling about systematic reviews. It used to be, it used to be gather all the evidence, wherever it is in the world, gather it all together, and then add it all up, and you find the truth. And now I feel it's more like this. It's actually, you're wading through a lot of rubbish. And a lot of it's not true. It's just rubbish. And most of it should be thrown away. It wasn't conducted to improve the care of patients. It was conducted to improve the career of the researcher. The researcher had lost their way. And this, research wasn't done for the right reason. And a lot of research, I think, should be thrown away, and we should be looking for, the diamonds, really. The evidence that really improves patient outcome. I think a lot of the studies that I've included in meta-analyses in the past, I wouldn't trust it. It should be thrown away. And actually, you get almost closer to the truth by throwing it away. Because you either are left with studies that are valid, or you're left with the conclusion that we just don't know, and that's a better answer. Saying, I've no idea whether mannitol is effective as a treatment for head injury is closer to the truth than believing it improves outcome when it doesn't.